Assalamualaikum, Sarah Zif. I am Shafiqa Ibrahim, and today we will present about our group presentation, which is heart disease prediction and classification. And together with me is Nurfadin Sakina and Nazatul Farah Hidayah. So let's move on to the next slide, please. Okay. This is the contents. We will explain to you about the abstract, focus of the research, objective and the problem, methods and techniques, discussion and results, strength and weakness, and also the conclusion. So next, first one is the abstract. So as we know that heart disease prognosis has become one of the most difficult challenges in medical sector in recent years. Around 1% dies of heart disease every minute in contemporary age. Data science is critical for analyzing massive amounts of data in healthcare professions. And due to the complexity of cardiac disease prediction, it is necessary to automate the process in order to reduce related risks and to inform the patient well in advance. So these projects will use the neural network to predict the heart disease, and based on things like the blood pressure, the cholesterol levels, heart rate, other things, patients will be categorized into different levels of coronary artery disease. And also in this project, we will use the dataset of 303 patients that was given by us, by the UCI Machine Learning Repository, and among the Python libraries, pandas and matplotlib are being used. So this project also use numpy and pandas. The machine learning part of this project will also be done with sklearn and keras. Next. So the focus of this research, the first thing is to compare the categorical model and the binary model result techniques for classification of heart disease diagnosis. The performance of evaluated with binary cross-entropy and the categorical cross-entropy specificity precisions F-score, probability of the misclassification error PME, probability of misclassification error, and the accuracy of the training set, testing set, and overall performance was analyzed. And the work of this paper is mostly about how to use data mining to predict heart disease. The human heart is the most important part of the body. It controls the flows of blood in our bodies. If there is any irregularity in the heart, it can cause pain in other parts of the body too. So any problem with the way the heart works can be called as a heart disease. There are many things that can lead to the heart disease, such as smoking, drinking alcohol, and eating low of fat. This can cause high blood pressure. This research is conducted to find the best approach in determining the best model to determine the accuracy results of the data set. So let's move on to the next slide. Please. Next is the objectives of the problem. So our objective is to determine the visibility of heart attacks and classify them using smaller sets of parameters. And the second one is to compare between the categorical model and also the binary model in order to determine the highest accuracy. And the problem is that we want to solve is we want to analyze the heart illness depending on whether it is present, their age, gender, type of chest discomfort, heart rate, and also the other factors. Poor clinical decisions can lead to disasters, so they aren't usually taken into account very often. Besides, it's important that hospitals cut their costs of clinical tests. Computer-based informations and or decision support system can help people do clinical tests at a lower cost if they use the right ones. The next. So now we are in the methods and techniques. So the first is this data set contains patients' data concerning heart disease diagnosis that was collected at several locations around the world. So there are about 76 attributes, including the age, sex, resting blood pressures, cholesterol levels, echocardiogram data, exercise habits, and many others. So to data, all published studies using this data focus on a subset of 14 attributes. So we also will do the same. And specifically, we use the data that collected at the Cleveland Clinic Foundation. Based on the things like blood pressure, cholesterol level, heart rate, and other things, patient will be categorized into different levels of coronary artery disease. We will also use the data set of 303 patients that was given to us by the UCI Machine Learning Repository. So among the Python libraries, we will use pandas and matplotlib. We also will use numpy and pandas. The machine learning part of this project will also be done with sklearn and keras. They will step added into the sklearn that make the train or test split a little more logical. So next. Okay, the first is normalization. So this project performs feature-wise normalization to deal the data like this. So which is when we subtract the mean and divide the standard deviation of each feature in the input data, which is a column in your input data matrix. This means each feature will be centered around 0 and will have the same standard deviation. Second is putting in dropout. So dropout is one of the best and most common ways to make neural networks more stable. It's called dropout when it's used on a layer. So during the training, a random number of output features are set to 0. So to obtain the outcome of the result, below are the steps that we carry out to evaluate the performance of the data. The first is importing the data set. Second is creating, training, and testing data sets. Third is building and training the neural network. And fourth is improving the results, which is a binary classification problem. So next. So the first one is the importing the data sets. So this is link. And this data set is available through the University of California, Irvine Machine Learning Repository. So like as I explained before, there's about 76 attributes, including the age, sex, resting blood pressures, cholesterol levels, echocardiogram data, exercise habits, and many others. So to data, all published studies using this data focus on 14 attributes. That's also same with us. We focus on the 14 attributes only. And to import the necessary data, we will use pandas built-in read_CSV function. So this is the attribute of the data set. The 14 attribute that we use. The first is age. The second is sex, CP, stress, BPS, call is for the cholesterol levels, FBS for the blood sugar level at fasting mode, rest ECG is the electrocardiographic results at rest, TELAC is the maximum heart rate attained by the patient, and then the 9, which I don't know how to spell it, but it's the exercise-induced angina. Is divided into 2 categories. 1 is for the yes, and 0 is for the no. And 10 is old peak. Is a ST depression induced angina. And slope is the peak exercise ST segment slope. It's divided into 3 categories. 1 is for upsloping. 2 is for flat, and 3 is for downsloping. CA is the number from 0 to 3 of major vessels colored by fluoroscopy. And third is TAL is here status divided into 3 categories. 3 for normal, 6 for fixed defect, and 7 for reversible defect. And the last one is the target, which consists of 0 and 1. So this is the data that consists of 303 data sets. For this one, we just show you the data, the last 20 data sets, which is from the 280 until 301 only. So as you can see here, there is age, sex, and the rest of attributes, and there is like the data for each data set. The next, thank you. So this is the description. After we count the means and the deviation, the minimum, also the maximum, and the 25%, 50%, 75%. So as you can see here, all of the data attributes has been described. For example, the age, the mean of the age is 54.37. Standard deviation of age is 9.08. And minimum of age is 29, and maximum of age is 77. And also same as this calculation, same goes with the rest of attributes, which will help us later in this project. So I will pass to the next presenter to present the rest. Thank you.
Hi, Assalamualaikum. My name is Nazatul Faridaya. So as you can see here, this is the bar chart of the heart disease frequency by age, and the age are from 29 to 77. And you can see that this graph is being plotted by target 0 and 1. So for target 1, we have from the age 29 to the age 76. And for target 1, we have the age from the 35 to 77. So as you can see here, the highest for the target 0 is 58. And for the target 1, the highest is 54 and the lowest is 29, 40, 61, 70, 74, and 76 years old. And then next. And below we can see the scatter graph for the target by age. So as you can see here, the scatter graph is plotted by age and the maximum heart rate. The graph shows that the disease data is all over the range of the age with the no disease data. The data have a few outlier data that are in the age of 30 with the heart rate of 200. Next. And then we continue the study by categorize the age by 5 from the age of 25 to 85. So as you can see here, we categorize the age show, for example, age 63. So the age category is 60 to 65. For the 37, the age category is 65 to 40. So then next. So from the data set, we can see the positive heart disease data age range from the range of 25 to 30 and 75 to 80 has one data age. So the greatest number of data in the range of 50 to 55. And then for the negative heart rate, the age range are from 75 to 80 have one each, and you can see from the age of 25 to 30 we have no data in that category. Then 75 to 55 also have no data in that category. Next. So this is the graph for the positive heart disease. So you can see here for the age 25 to 30 have 1 and also 75, and the highest is at the age category of 50 to 55. Next. So this is the negative heart rate, heart disease data range. As you can see here, 75 to 80 we have one, and then at the 25 to 30 we have no data in that category. And also for the 70 to 75 we have no data in that category, and the highest is 55 to 60. Next. So this is the graph by category. As you can see, the highest is 55 to 60. And next. So, so next we continue by creating a training and testing dataset. So for this research, we need to create a training and testing dataset. So for this study, we use sklearn. So sklearn train trace split function is to generate a training dataset 80% of the total data and testing dataset 20% of the total data. For two dataset will be the training dataset and the remaining will be the testing dataset. So we check the mean range of the dataset for the training dataset. Next, then we build the training and the training for the neural network. And for this study, we use TensorFlow to define the neural network model. So for the model, we have two models with the categorical model. So for the categorical model, we use softmax activation function in the last layer, and we use the optimizer RMS PROP for the categorical model. So the training is trained by 100 epoch and the batch size is 10. So I will let my teammate to continue for the rest. Thank you.
Okay, thank you, Nazatul. So for the next is the methods and techniques. So this is the model sequential. This is the result of the command that we execute, which is it shows the layer. We have 5 layer and the output and also the param. So the total param is 378 and trainable params is also 378 and trainable param is 0. And to build the model, the dataset is converted to binary data for the training and testing data. The model is built with the activation of sigmoid function at the last layer of the network, the ReLU activation in between the layer. So sigmoid saturate and kill gradients, sigmoid outputs are not zero-centered. And for the ReLU activation, use the ReLU nonlinearity. Be careful with the learning rates and possibly monitor the fraction of dead units in the network. If this concern, give leaky ReLU or max out a try. Never use sigmoid tritem but expect it to work worse than ReLU max out. And for the softmax function is used as the activation function in the output layer of neural network models that predict a multinomial probability distribution. Okay, the next is methods and techniques. Then the loss layer use the binary cross entropy for the training model. We use the same optimizer RMS prop for the binary model. The training of the model we set at 100 epoch and the batch size is 10. So this is the output. Okay, and next is the output for the previous process. Sequential 1, model sequential 1. Next is the categorical model result. This is for the categorical. And as we can see in the chart, we have two, which is the train and test. For the model accuracy and also the model loss also the same, we have two, which is the train and test. And this is the binary model result for the model accuracy, for train and test, and for the model loss also the same. We have for the train and test also. As if we were to compare between binary and categorical, we can see the binary is slightly higher compared to the categorical in terms of the accuracy. And also the model loss, compared to the categorical, the binary is more lower compared to the categorical. Okay. And next is, this is the result for categorical model. As we can see here that the binary is more higher compared to the categorical model in terms of the accuracy, which is 0.77 for the categorical model, and for binary model is 0.83. Okay, sorry. And for the strength and weakness, is learn how to create artificial neural network using keras. We try to get a higher accuracy for the heart disease dataset. Apparently, categorical cross entropy is used for more than 2 classes, and binary cross entropy is for 2 classes. Since there are 2 digits, we should be using binary cross entropy compared to the categorical cross entropy. And for this research, we gather the difference between these two models and show the significant result of the binary model. This could be because it is hard to tell the various levels of heart disease apart, which has the classes 1 until 4. There are 2 ways to solve this problem, which is heart disease or no disease. To achieve this result, we use the binary cross entropy by classifying the data into 2 categories. As a result, binary cross entropy show higher accuracy compared to categorical cross entropy. So with the help of data mining before the starting of the model, we are able to determine the categories to achieve a better of the model. From the ANN, artificial neural network, a multi-layer perception of the sigmoids ReLU, we were able to develop a model to help in giving a better result. And in conclusion, in this study, machine learning techniques were employed to analyze raw data and deliver a fresh and original discernment towards heart disease. Heart disease prediction is both difficult and critical in the medical industry. However, if the condition is recognized early and preventative measures are implemented as soon as feasible, the fatality rate can be dramatically reduced. As the research could be done, we find that the model could be improved by improving the accuracy of the binary cross entropy to have a better result. The research also could be improved by conducting research and determining the features of the dataset so that we could improve the prediction by determining the features that can be used to predict the heart disease. And the model also could be used by different datasets such as Framingham dataset that has a similar feature with the Cleveland dataset. So that's all from our team. Thank you so much for listening.
Thank you.